everyone. Today we're going to learn what to do in the event a patient is boarding with us and they need medication overnight. And so it's something that ICU is going to be helping us with, whether it's medication, walks, or just checking on them overnight. So what I have here is I have our treatment sheets that ICU uses. They have a yellow one and then they have a white one. The yellow one's for referrals and the white one is for if they're our client. At the top here, I'll use the white one as an example because they're both the same. So the top here is where we put our labels. So whatever patient is needing the treatment, you're going to place the label on like that. Right here is where you can notate if they are aggressive. You can notate if they are, if you need to wear gloves, sling walk them, or if they need an e-collar. Typically, boarding doesn't use any of these, but those are what they are, and you would highlight them if any of those are needed. So you would just highlight it like that. And then right here is where you put the date that they are being admitted. So let's just use today's date, and we would write 10/8/19. And then on this line right here, you would either write the same date or you would write whatever date it was. Typically, if they are boarding with us, we're going to go ahead and make this treatment sheet through their entire stay. So if they're staying 5 nights, we'll make 5 of these. If they're staying 10, we'll make 10 of these. Sometimes what I will do is I'll go ahead and I will, again, to the side, write when they are going home. Just so it's clear that ICU is aware they're going to be staying for a long time. In this box right here, where it says CPR and DNR, you're going to highlight whichever one it is. So if it's CPR, you would highlight that. If it's the other one, you're going to highlight that. The next thing is your contact information, which you would fill that out. And then the current weight. ICU likes it if you do in pounds and in kgs. This next line where it says IVC date and location, that's for an IV catheter. Boarding patients will not have those, so it's not something you have to worry about. Same thing for admitting doctor. Now, attending doctor is where you would write whichever doctor is in ICU. So you would have to ask one of the ICU technicians. The next line down where it says problem, that's what you're going to fill out, whatever ICU is responsible for. So in this case, let's just say that this patient needs medication at 11 p.m. So you're going to say patient needs tramadol at 11 p.m. And then you can also to the side write in runs. That way they know what location this pet is in. And then right down here, you're going to fill out the medication name. So we're going to say it's tramadol. They like to know the milligrams, so it's 50. And then you would say 1 tab TID. And TID means every 8 hours. So if it needs it at 11 p.m., you're going to highlight 11, just like that. And you can go ahead and highlight this box as well. And then on the other times when boarding's responsible for it, you're going to just write boarding. So if it's due every 8 hours, let's see, 2, 3, 4, 5, 6, 7, 8. Boarding is responsible to give it at 7 a.m. and at 3 p.m. like that. Okay. And then also, if you look down here, it says the treatment sheet was prepared by. We're going to go ahead and write my name. And then the doctor has to get approval, or sometimes you can ask the technician if it's something simple, since it's not an actual patient that's getting admitted to ICU. If you flip it over on the back, you will see where the monitoring is at, feeding directions, and walks. It's the same thing as our yellow paper here. Same exact thing. So if ICU does need to monitor the pet overnight, again, you would just highlight attitude and then whatever time they need to check on the pet. If ICU is responsible for feeding, again, you would just highlight whatever times. And if they're responsible for walks, again, you would highlight the time. And then communicate that with the ICU technician that you are speaking to. So, and that's how you fill out a treatment sheet. So, and again, you would have to fill out however many nights that they're staying with us. So if they're staying 2 nights, then you need to make 2 treatment sheets. If they're staying 5 nights, you need to make 5. The other parts to this when a boarder needs something done by the ICU team is you need to make sure that you send a detailed email out. The email needs to include a check-in and check-out dates. They need to include the location, so wherever the pet is located in the hospital. It also needs to include what ICU is responsible for, so whether that's medications, walks, feedings, monitoring the attitude, whatever it is, it needs to be included in the email, as well as whoever you spoke to during that day and who you communicated that to. The other thing that we need to do is write it on the ICU mirror. So when you go into ICU, you'll see a giant clear window that looks out to treatment. You're gonna write it on the mirror. Again, the pet's name, check-in date, when it's leaving, what needs to happen. That way it's clear across the board, there's no questions. I think that's it. Let's see. So if you guys have any questions regarding this video, or if I missed anything, please don't be afraid to reach back out to me. But I think I simplified it, and at least I got the big things for you. So that's it. This is the window that is in ICU and where you write the information at.